Welcome back to American Agenda. I'm Bob Sellers here with Allison Maloney. Wanted to let you know, folks, as we told you before, the president has vetoed the large defense spending bill. He also sent out a statement explaining why, and we've talked about this a little bit. For one thing, he has a problem with the Section 230 exclusion in the Communications Act that a lot of these social media companies are getting, so that they are censoring, and they shouldn't be. So he has a problem with that. He doesn't want them to get off scot-free. He also has a problem with plans that would not allow, that would rename some of the bases, for instance, that have been named after Confederate leaders, because, as he is saying, it washes away history and dishonors the immense progress our country has fought for in realizing our founding principles. So he doesn't necessarily want to rename those bases just because they were named after Confederate leaders, because they have existed a long time and played a large role in the success of our country militarily. So just want to let you know some of the rationale behind what the president has done. Didn't mean to talk so long. Allison, I'll turn it over to you.
All right. Well, Texas announced that it will split from CDC guidance on who should first get access to the COVID-19 vaccine. Folks 65 years of age or older in Texas will get the shot sooner than the CDC recommends. Now, in Massachusetts, prisoners and prison guards will now be in the first round of vaccine recipients. More states are also expected to break away as they set their own priorities for who gets the next round of shots. So is it fair to let each state decide? Let's bring back our panel now to discuss. Adam, what do you think about this? Because, yeah, we're hearing what Florida's kind of making their own decision, Texas, we've got Massachusetts, who we just mentioned. What do you think?
I think it's important that we allow the states to maintain their authority to move forward with the decisions that are important for public health and safety within their constituency. I think every state is different. Obviously, the pandemic is global, but I did read and understand the Texas folks were looking at distributing to the at-risk populations like the elderly, and I think that's important. New York versus Texas, there's different things on the ground, and who knows better than the governors in those states. So I think it's the prerogative of the state to work with CDC, who essentially issues the guidance and guidelines, but the decision should be the states.
Yeah, Adam, good point. Brooke, Adam brought up a good point. Going to Massachusetts, so we keep hearing from health officials that 65 and older, right? They're most at risk. They're the ones that have been in the hospital. They're the ones who are getting it. Yet states like Massachusetts are deciding that prisoners should be the first to get the vaccine. What do you think about that?
Well, first of all, I think that every time we talk about the vaccine, we should give an enormous amount of credit to President Trump, because what he accomplished with Operation Warp Speed, getting these vaccines through clinical trials at a speed completely unprecedented, is nothing short of a miracle. And, I agree with Adam. The CDC guidelines are just that. They're guidelines, and every state is allowed to decide. And what this becomes beyond just a question of medical ethics, it's really a question of the state's values. Now, I personally think that the elderly are one of the most important members of our society, and they also happen to be, as you said, at the highest risk. So you would think it would be an easy choice that they should be the first people to get the vaccine. But states like Massachusetts, for example, think otherwise. They're giving prisoners the first vaccine. So it's created this big picture where your access to a vaccine really depends upon the state that you're living in.
Yeah, Christina brought up a good point as well. I mean, it's up to the states now to really decide. They're taking the guidance of the CDC. But, I have a father who's 70 and he has a heart condition. And now he's not going to be able to get that vaccine because somebody who is convicted of perhaps rape is going to get the vaccine before him.
I don't know if that's quite the same analogy. I think, the Massachusetts isn't saying that the elderly populations aren't equally worthy of getting the same access in the front round. The elderly are still there. But they are acknowledging that there has been a problem with rapid rise of the corona cases in the prison systems because they are so tightly congested there, and that the virus spreads very quickly. So I understand what they're doing there. The guidance from the CDC, in my mind, though, is still really important, right? I mean, it's kind of like when you get on the airplane and they tell you if there's a problem, make sure you put your mask on first before you help your kids or somebody else around you. Is because if you're knocked out and unconscious, you can't help anybody else. I think that's still true for our frontline workers and our first responders.
All right, Bob, what do you think?
I kind of agree that I wouldn't put prisoners first. I know that they've had outbreaks in a lot of prisons and they're higher risk, but I feel like I'm not saying there's never an exception, but I think the people there have done things that got them there, and that shouldn't be our priority. And we had earlier, Allison, we had a guest because we're kind of talking around the issue here. A lot of these decisions from these states are political. A lot of the decision from the CDC is political. And Betsy McCoy, former lieutenant governor of New York, came on and said some of this is race-based because some of the people making these decisions feel like the frontline workers are more diverse. And since they are more diverse, they should get the vaccine before those that are older because they happen to be whiter. And that's a political decision that not everybody is comfortable with, including Betsy McCoy.
Yeah, Adam, I don't know if you had a chance to read Betsy McCoy's article, but, she said we're bringing race into this now.
It's an interesting article, and I'll just say that, I think it's important that I don't want to use this segment to say that we are a country built on Judeo-Christian values. And, I don't like to pit one person as a priority. As a leader of a country or as just a leader in the community, my job is to make sure everybody has fair access to education, to medical, and more. So I would say that, obviously we want to prioritize, the folks that are on the front lines. We want to prioritize the elderly who are, in my opinion, and also in the opinion of some health experts who are at-risk population. But I don't want to pit it against the prisoners. I don't want to pit it against folks who they've classified as less than, the 1%. So we've got to be careful with that as a people. We don't want to fight over the scarcity of resources, but we do want to be smart on our distribution plan. And I think we're doing just well in how we classify that for every American.
Yeah, Brookins, seems no matter what we have that comes our way, it always gets political.
Right. And I think everybody would agree that the politicization, not only of this vaccine, but COVID in general, has really done us a disservice. And I just want to comment that this is a limited resource. So it is somewhat of a zero-sum game. If you are giving the vaccine to one group of people, you are denying it from another group of people. So the question is, how do we prioritize it? It should be who is greatest at risk. I mean, that is my personal opinion. I think that what makes the most sense.
All right, guys, we got to wrap it up on this segment, but we're going to have you back to talk about lots more wonderful topics. Bob, it's time to talk about the app.
It is. Let me show you how easy. I've got the app right here. Press it, comes up, and then pressing it again brings up.
If you are giving the vaccine to one group of people.
There you go. It's that easy. So that's the way you watch TV now. Wherever you are, your phone is going with you or on the iPad, you can download the Newsmax TV app. It's easy to use, as I just showed you. It's free. You can do it on your iPhone. You can do it on your Android. And being free, as opposed to if you want to watch CNN, MSNBC, the cable networks, you typically have to have some kind of subscription to log on to it, but not in this case. And that's one of the reasons millions of people are now downloading us to watch on OTT devices. Probably takes less than a minute, so head on over to the App Store for your iPhone or Android phone and download it. It's one of the most downloaded free apps on the Apple Store. We think that you will like it. We hope so. And we will be back with more of American Agenda after this.